With continuation of the discussion of diabetic kidney disease, the risk factor for progression of diabetic kidney disease can be divided as the susceptibility factors, initiation factors, and the progression factors. And the important things are the risk factor can be classified as the demographic factors, hereditary, systemic, renal factors, and the other modifiable risk factor. And the important of which are family history of diabetic kidney disease, uncontrolled hyperglycemia, hypertension, obesity. A previous history of AKA acts as an important progressing factor and a high protein intake. There are other modifiable risk factors which include drugs, hyperuricemia, and vitamin D deficiency also. These are all the modifiable risk factor for the diabetic kidney disease progression. Coming to the other important question, when to plan for biopsy in a case of diabetic kidney disease patients presenting with renal dysfunction or anything, or if the patient is having nephrotic range proteinuria. The indications for biopsy in diabetic kidney disease are: if the patient is having nephrotic syndrome without any signs of diabetic retinopathy, and the onset of nephrotic syndrome is less than 5 years in a type 1 diabetic patient, or whenever there is a sudden onset of nephrotic syndrome without any preceding stage of microalbuminuria, and the presence of urinary active sediment, that is the presence of RBCs caused dysmorphic RBC, or microscopic hematuria, and unexplained AKI or RPRF. If there is a rapidly progressive decline in the renal function which is unexplained, then also have to be planned for biopsy. These are all the important indications of biopsy. Other adding factor to this list is presence of any systemic diseases to suspect a renal involvement. For example, presence of low C3, C4, or when we suspect vasculitis or amyloidosis, or any systemic disease suspicion is there, then also a diabetic kidney disease needs biopsy. So grossly, the important indications for biopsy are, I classified into nephrotic syndrome with these features and the presence of these features like that. Important indications are totally 6 as given in the books. One is the absence of retinopathy less than 5 years, sudden onset nephrotic syndrome, urinary active sediments, AKA or RPRF, which is unexplained. These are all the important indications of biopsy in diabetic kidney disease or diabetic nephropathy. Next,